Welcome back. As people approach retirement, they start thinking about health insurance and signing up for Medicare. There are important deadlines that you certainly do not want to miss. Our financial advisor, Elaine Beadle, is here to help you with that. And Elaine, most importantly, what do people need to know at this time in their lives?
Well, they ask those very questions. When do I start Social Security? When do I sign up for Medicare? And it's important you do it at the right timing to get the best pricing. So everyone's eligible for Medicare at age 65. Part A is free, which is the hospital insurance. Part B is that health insurance that goes for your doctor payments and things like that, and it comes with a premium. Well, if you're already on Social Security, so maybe you started early at 62 or whatever, you're going to get 2 months before your age 65 a notice saying we can automatically enroll you in your Medicare plans. So you're taken care of there. But if you're not on Social Security, you do need to actively go and enroll. And you need to enroll within 7 months. 3 months before your 65th birthday month, 3 months after. So if your birthday's in August, May, June, July, then August, and then September, October, November, to stay within the time and not have a penalty. So we really want people to get signed up then so they can avoid what's a 10% penalty on top of your premium.
And what if you're you're still working?
Well, if you're still working, that's not a problem.
Okay.
Because if you're still working, you're covered by your group employer plan, so you don't need to do that until you end that and you leave work, whatever age you are. You'll have 8 months called a special enrollment period that you can actually go in and not have to pay the penalty again. So you want to get enrolled during that time period.
And is that also true for retiree benefits also?
No, and that's where people sometimes make the mistake. If you're getting retiree health insurance benefits, or if you're on COBRA, neither one of those count. So if you pass your 65th birthday and get outside of that 7-month enrollment period, then you're going to also have that penalty to pay, so you need to be careful. Because a lot of times in retiree insurance actually says, we're your secondary insurance. So Medicare is your primary, well, your secondary. So it's more like a Medicare supplement or a Medigap policy.
Right, you mentioned Medigap. When do you buy that?
Well, another time, if you want to get good pricing again, 6 months after you're enrolled for Medicare, so at 65 or through the special enrollment period, you've got 6 months that an insurer will sell you without underwriting, which basically means if you're unhealthy, you'll still pay the same premium as a healthy person. If you go outside that 6-month time period, then based on your health, your premium could be a lot higher than someone else's.
So basically what I'm hearing is you got to understand the deadlines.
Right, exactly, and know your situation, know what's available to you, and make the right decision. Otherwise, it is going to get a little more costly.
All right, Elaine, a lot to learn, a lot to know, and a lot to pay attention to, so we appreciate you coming in today.
You're welcome.
Well, would you know if your child was being abused? We have some of the warning signs and chance for you to help children learn about their own body safety. We'll explain in Focus.